Not a lot of people know that MRI stands for magnetic resonance imaging, much less what that means. What an MRI procedure does is it takes images of different tissues or organs of the body if they think that there might be something wrong internally. Today I'll be informing you about MRI techs and what is involved in their career. The three main points I will be touching on within the MRI tech's career are their education, job description, and then certain precautions. The first point in the MRI tech's career is their education. For any job or career, you will have to learn things about that field to become proficient. This career is no exception. But for going into the field of MRI, you will need to go to school for an associate's degree or higher. But higher education is often advantageous in this situation. Usually classes within this degree include chemistry, biology, physics, and math. Other classes that would be more focused on the MRI aspect of the career are classes like medical terminology, pathology, patient care, safety, ethics, anatomy and physiology, as well as MRI equipment, which are all stated in the healthcarepathway.com. After getting their degree, the person will also be required to take an exam, most commonly through the American Registry of Radiologic Technologists, ARRT, so that they can get their certification to start working. After finally getting their degree and certifications, the second point of the MRI text is their job description. The Better Team organization mentions that as an MRI tech, there are a lot of things to do, whether it be pre-patient, patient, or post-patient work. Pre-patient tasks an MRI tech usually takes care of is analyzing the patient's history to see if there's anything like injuries or pacemakers that have metal that could interfere with the process of the scan. Another thing they have to do before the patient is there is the technologists have to prepare a contrast dye called gadolinium to give their patient. They also have to make sure the area is clean and sterile for the patient. When the patient finally arrives, the MRI tech has to make sure the patient is well informed with the process that will be happening during the patient's appointment. The tech operates the equipment safely and adjusts the patient if they are not comfortable. And then finally, completing the scan with certain specifications and the physician's notes that are required. Finally, after the patient leaves the MRI tech has to make sure the area is clean and sterilized. They have to make sure the equipment is up to code or if there are any problems, as well as writing reports of the information that needs to be passed on. Besides their job description of the MRI tech, there are certain precautions that the MRI tech has to make sure for their patients or for themselves. Some of the examples given by radiologyinfo.org goes both for the patient and the technologist. Things that the MRI tech does to keep themselves safe include writing reports and any problems to the relevant stakeholders, and making sure their workplace is clean and tidy. As for the patient, the tech is required to make sure that there are no metals on the person, for it could severely harm the patient. If the patient has a pacemaker or another type of metal that is used for a patient's well-being, the machine could mess it up, which could severely injure the patient or worse. As well as certain clothing or makeup that hold metallic threads that could also harm the patient. And if there's metal on the patient, that could also mess up the image produced, making the technologist and physician to not be able to properly diagnose the patient. There are a lot of things that MRI techs have to do between getting their education, knowing their job description, and then the precautions they have to keep everyone in the process safe. So hopefully not only do you know that what MRI stands for and what the MRI techs do, but also what is involved in the career of an MRI tech.